All right, today I'm going to show you and walk you through a treatment of diluting Radiesse down to use as a biostimulator more so than a filler. Now, if we remember, Radiesse comes in a nice, thick, high G prime paste, which is great for skeletal augmentation, jaw lines or cheekbones, things like that. However, we can also use those biostimulating properties to stimulate collagen regrowth. And we're going to do that today in the patient by stimulating collagenesis in the lower face. One of my favorite treatments to do. I do it about once a year on patients, and they absolutely love it. But in order to do that, because it comes in a thick paste, we have to dilute it down to where it flows and it can work into the tissues and get all those little calcium particles sporadically spread out in the subdermis to get the collagenesis going. And so I'm going to show you how I dilute it down, and then we're going to walk you through the procedure on how we inject that into the lower face. So let's dive into it. All right, so today we're going to show you how I mix up Radiesse. So we're going to do a lower face, and my favorite dilution for a lower face is what we call a 1-to-1 dilution. What does that mean? It means we're going to put in 1.5 cc's of an injectable, of the injectable product, and we're going to mix it with another 1.5 cc of solution. And what solution are we going to do? 1 cc of bacteriostatic saline, and I'm going to mix half a cc of lidocaine. So that will be 1.5 cc's total, and that will be added to the Radiesse. So in order to dilute Radiesse down, you're going to need a couple of things. You're going to need 2 3cc syringes, all right? Why? Because the entire volume of this product has to fit in there. So we're going to have half 1.5 cc's of Radiesse with another 1.5 cc's of those 2 fluids I just mentioned. All right. We're going to need a needle. This is if you're going to be injecting it with the needle. If you're not going to be injecting it with the needle, then you're going to be using a cannula. And then you're going to need a Y2Y, a Luer-lock to Luer-lock adapter. This is my favorite one. It comes from Baxter Pharmaceuticals. It's called Rapidfill connector, Luer-lock to Luer-lock. And these are nice. These are sterile, and they're really good to mix in. I'll show you why we need that in a little bit. Obviously, we're going to need the product, an alcohol swab to swab everything down. I like to lay out a clean surface such as this. This is not a sterile procedure. You don't need a sterile field. I mean, we're going to keep the contents sterile, but you don't need a sterile field to do that. So the first thing we'll do is we'll open up the package of the Radiesse, and the Radiesse syringe comes looking like that. Throw that in the trash. And there's 1.5 cc's of product. They usually overfill it a little bit, so you have a little wiggle room, but I'll use the entire volume of that. All right. So the first thing I'm going to do is I'm going to draw up my diluent. Okay. So we're getting our alcohol swab, and then we'll swab that hub of the lidocaine. Since I've already used this a little bit, swab the hub of that. And then I'm going to take the needle that comes in the package, and I'm going to draw up the fluid from the diluent. Okay, we'll pull that out. I'll get the needle that comes, and then we're going to draw up. I do bacteriostatic saline first because I don't mind getting a little saline in the lidocaine, but I don't want to get any lidocaine in the saline. All right, and we'll drop 1 cc. My angle's kind of weird for the camera here, but we'll flick that out and maybe get just a smidge extra, just so we make sure we have enough dilute in there. Okay, now I'm going to add a half a cc of lidocaine, about there. Push that air out, and we've got just about 1.5 cc's total. All right, we'll then remove this needle like that. And now I'm going to get out my Y2Y, my Luer-lock to Luer-lock. Okay, this is nice and sterile. I don't want to touch the ends of those. Okay, and now I'm going to push all of this product into this. So we'll take off that cap. And this is the fun part. Make sure it's nice and tight. And then we're going to squeeze all of that product in with the diluent. Then you take off this side. If I take off this side, there's going to be some straight product in the hub. So we want to make sure we take off this side. Save this syringe because we're going to use this to inject the product into the patient. All right, so everything's nice and sterile. The ends have not touched anything. Now I'm going to get my other 3cc syringe out, and I'm going to hook that up to the Luer, and now we're going to go back and forth. I'm going to squish it into that and back. And you can see with every pass, it's getting more and more mixed up, okay? I usually do this about 20 to 30 times, back and forth. And you can see it's almost homogeneous now. Now, if you try, like let's say we were doing a 2-to-1 dilution, we had 3 cc's in there, and this was complete, we would blow the hub because there's only enough for 3 cc's of fluid. We'd have to use a 5cc syringe if we want to do like a 2-to-1 dilution or a 1.5-to-1 dilution, something like that. So with you can't see this on the video, but with every mix, it's getting easier and easier for my thumbs to go back and forth. So that looks pretty good. So now we have a nice homogeneous amount of fluid. Now what I'm going to do is I'm going to, again, where the product is, I'm going to take that one off, the one without product on, and then I'm going to go back to this one. Now, if I push all of this into this syringe, it's going to blow the syringe out because this will only hold 1.5 cc's. So I am just going to squish it in a little bit. Now, remember, that little first part of the Radiesse syringe still had straight product. So I'm just going to kind of mix it up a little bit just to kind of get that straight product mixed in with the rest of the stuff. It's not much, but it's caused problems for me in the past. So that's a little hack. Just mix that up a little bit more just to get a little bit of that product in. Now, don't push this whole thing in or you're going to blow out the other side. Okay, so that feels pretty mixed up to me. I'm going to go and I'm going to fill that up to 1.5. I'm going to take off this end, and then I'm going to attach my cannula to it. Okay. Today we're using a Dermasculpt 22 gauge, 2 3/4 inch cannula. All right. You might want to use a smaller one, but this is the best one I have found for what we're going to be doing today, which is a lower face biostimulation. Okay. So we're going to open up this, and then I am inside this container. You are going to find both the cannula and then a pilot hole maker. This is what you're going to punch through the skin to make the entry hole for the cannula. So I'm going to leave that in there, and I'm just going to pull that out, and I'm going to connect that to the cannula. All right. And then if you want to keep this end sterile, you can just hook that back up. So that's all nice and sterile, so I can move it around. Everything's contained. I'm going to leave it just like that. So that's how we mix Radiesse in a 1-to-1 dilution. A little bit of lidocaine, a little bit of bacteriostatic saline, mix it in. This is now a very dilute product. It's going to flow like water. We're going to get it exactly where we want to go. So there you go. All right, so we just did our dilution down for dilute Radiesse treatment to the lower face. Now I'm going to draw up a little bit of lidocaine with epinephrine. Just swab the hub. I'm going to use an insulin needle, and this lidocaine for epinephrine is going to be utilized for numbing the area that the pilot hole for my cannula is going to go into. It also reduces the bleeding as well. So I'm just going to draw up just a syringe with an insulin needle of lidocaine. I probably won't use all of it, but lidocaine's cheap, and I don't mind if I'm getting a 0.5 cc of lidocaine. Okay, I'm going to recap that. This is just going to numb the area. Like if I was doing the back of the hands, I would just put a little bleb right there so I can, through one pilot hole, treat the back of the hands. They're not going to feel the poke as much. This won't bruise as much, and it just really helps out. So that's another little hack if you ever are using a cannula. Put a little bleb right under the epidermis of lidocaine, and it keeps everything from bleeding and bruising, which is really nice. All right, so I'm going to drop some Xeomin, and this patient that I have coming in needs 42 units of Xeomin. I do a 2.5-to-1 dilution of Xeomin, and a single insulin syringe will only hold 20 units of that dilution. So, 2, 4, 6, 8, 10, 12, 14, 16, 18, 20. So this patient I'm doing is going to need 42 units. So obviously, if this only holds 20, I'm going to need not only 1, 2, but 3 syringes or 3 insulin syringes to get the job done. Well, I use a high quality insulin syringe, and these insulin syringes cost me a little over 70 cents a piece. And I don't want to spend 70 cents just to inject two little units of tox. So instead of using a whole syringe for 2, I'm going to overdraw to about there on 1 syringe and save myself 70 cents. And there's still plenty of leeway. I don't like to do more than that because there's a little hump right there you'll feel, like right there. You see how that slid out? So you can't do more than 2 or this is going to come completely out. But you can overfill to right about there for 2 units. And I'll show you what that looks like here in a little bit. So here's my Xeomin. We're going to push that air in just to make the volume come out a little easier. And then we're going to draw back 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, and then overdraw about 2. It still stays. It's nice and tight. And now I have 22 22 units in this syringe. So that's a little hack to save you a little bit of money. That only works with the BD syringes. If you're using the cheapo Amazon syringes, you won't be able to do that, but they're cheap anyways. They're only about 20 cents a piece, so you'll just have to eat the cost of that. Anyways, that's a little hack.